To understand irregular bleeding, let's first understand what is vaginal bleeding, the regular menstrual cycles. So every month, a woman undergoes regular vaginal bleeding, menstrual cycles we call it, which the uterus sheds every month regularly. And it's under the effect of the hormones that is produced by the ovaries. So usually after ovulation, when the ovary produces an egg, the uterine lining thickens and it builds up in order to receive a pregnancy. And when pregnancy doesn't happen, like egg is not fertilized, then the uterus sheds its lining, and that is bleeding. So this is menstrual cycle, which happens every cycle, and it has like regular pattern also. So we say normal menstrual cycles when the bleeding cycle from the first day of one period to the first day of next period is minimum 21 days, and usually it varies from 21 to 35 days cycle. So this is normal menstrual cycle. And usually the bleeding averages from 2 to 7 days. So some women may bleed lightly, like scanty flow from 2 to 4 days, and some women may bleed even up to 7 days. That is considered normal. Some women feel it like mild pain during bleeding. Some may just be comfortable with it. So this is normal. Normally, from the first day of one cycle to the first day of next cycle, it should be from 21 to 35 days on an average. So this is normal cycle. Anything apart from this, like if it comes in 15 to 20 days interval or more than 35 days interval, it is not considered as regular cycle. See, there are many reasons for it, many causes for it. But the most common cause for irregular vaginal bleeding nowadays is in the reproductive age group is PCOD. Okay, and but there are some physiological causes like pregnancy, breastfeeding, when a woman doesn't bleed. And the pathological conditions or the problems where they may bleed irregularly is PCOD or abnormal thyroid function, most commonly hypothyroidism. And there may be certain other reasons like fibroids or abnormal polyps, which are found inside the uterus, which are tumor growths, which are found inside the uterus. They are not cancers, but yes, they may lead to irregular vaginal bleeding. And obviously, there are certain cancers, uterine cancers and ovarian cancers, which may also lead to irregular bleeding. But there are certain other normal conditions which we face in our day-to-day lives, like changes in our normal routine, like stress related to any, like your work schedule or your normal family problems or anything that may upset your bleeding pattern. Or if you are exercising too much, then even then you may have abnormal bleeding pattern. Or if you are leading a sedentary lifestyle, you have put on weight, that can also lead to irregular vaginal bleeding. So these are few common causes which may lead to abnormal bleeding patterns. This is something which women have commonly reported, like after COVID infections, they have felt certain changes in their cycles, like abnormal period also, like abnormal menstrual cycle length, as well as abnormal bleeding during the periods. Most of the women, they have completed about like heavy bleeding during periods. They're passing clots and all. And some have complained about their irregular patterns. Like earlier, they used to get periods in 20 days or 30 days. Now they are experiencing like in 15 days or late also like 60 days, or they have skipped their periods. So this is something which is which we have noticed, and it's most likely due to the infection. And any infection, it causes stress, and most likely this is stress related only. Not only COVID infection, even with COVID vaccinations, people have noticed abnormal periods. Whenever they feel that the normal pattern has been disrupted, then they can see a doctor. So disruptive pattern means either in the length of the cycle, either the length has become shortened, or it has like she's getting delayed periods more than 35, 40 or 60 days interval. Then she needs to consult her doctor. Or if the bleeding pattern, like the flow pattern has changed. Normally, if she bleeds like 5 to 6 days and it has now started bleeding for 10 days, 8 days, 10 days, and the bleeding is heavy, like she's passing clots or something. So we call it heavy bleeding. So then she need to consult her doctor. Or if she's experiencing any abnormal pain which she was not experiencing earlier, or any increased pain that she has been experiencing recently, then she needs to consult her doctor. Other symptoms and signs of abnormal bleeding. See, this bleeding itself is a symptom and sign. If there is change in pattern, irregular periods, heavy flow, if she is PCOD, then she will be noticing some other changes in her body. Like she may be putting on weight. She may be complaining of acne on her face or back. She may be complaining of increased facial hair and body hair, like increased hair on the upper lip or chin area, chest area, or belly area. That's due to increased male hormones in the PCOD patients. Or if she is putting on weight. So all these conditions, they indicate some problems like PCOD. Or in case of abnormal thyroid functions, like she may will be putting on weight. So if she notices some other features along with the irregular bleeding patterns, then definitely there is some cause and she should consult her healthcare provider. So this is, no, I would not say that, yes, you have PCOS, but yes, it's one of the most common cause of abnormal bleeding patterns. So nowadays, like our lifestyle has changed a lot. So girls are leading a sedentary lifestyle. They are more into their houses, or their working pattern is such that physical activity is very much restricted. Eating behavior has changed. Like we are more into cooked and processed, like processed foods and ready-made foods and fast foods. So all these things have changed our lifestyles, and that's the reason PCOD is so common nowadays. So yes, it's one of the most common cause of abnormal bleeding patterns. So if you have all these symptoms or features that I just mentioned, then please see your gynecologist or endocrinologist so that they can find out the real problem and they can tell you the solutions for this. Whenever the period starts, the puberty phase or the the menarche period, that is not very smooth and regular for all the women. So it may it takes 2 to 3 years for it to become regular. And usually it's like they may have delayed cycles or they may have more frequent cycles. So if they are getting delayed cycles, that's pretty much fine. But frequent cycles can lead to anemia and weakness and tiredness. So yes, they need to consult a doctor so that they can be put on some medications if required, and they can be tested also for thyroid and other parameters if it's excessive. But normally it settles down in 2 to 3 years time. So, and similar is the case with the menopause. When it's about to finish, again, it takes around a couple of months to settle down before before stopping. It becomes irregular and it takes a couple of months to settle down. So this is a common behavior. We do have clinical treatment, like the most common reason for abnormal bleeding, irregular bleeding pattern is the hormonal imbalance. And that's why we set it right through birth control pills or oral contraceptive pills, which are a combination of estrogen and progesterone tablets. So normally they are given to regularize the period. And other causes like lifestyle changes in case of PCOD, and there are also other anti-male hormone treatment like anti-androgen treatment we provide for acne and all. And so it's cause targeted treatment. Like if PCOD, the hormonal treatments works best. And if there is any abnormal thyroid function, then please get the thyroid function test done and be on antithyroid medications to treat them. So accordingly, we provide treatment, but the most common is birth control pills to set them regular. You can take care of your body, you can take care of your lifestyle, you can maintain a healthy lifestyle to have a normal regular period, like exercise regularly, take care of your diet, avoid junk and avoid fast foods, eat in moderation, and regular exercises and yoga, that also keeps us healthy and stress-free, that also regulates our cycles. So these are certain normal routine that we can add to your daily lifestyle, so which will help us maintain a regular menstrual cycles. you can maintain a menstrual calendar. You can note down the dates when you start your periods and when it ends. How many days do you bleed? You can mark on the calendar. Whether there was spotting, how many days of spotting, how many days of bleeding. All these things can be marked, whether there was any associated pain. So this is the way we maintain a calendar. So this can be done on a regular calendar, or nowadays we have many apps for this to maintain your menstrual cycle, like the Flow apps, and there are many apps which you can track. And after noting down the days for around like 5 to 6 months, then you would come to know that, okay, this is a regular pattern. You can observe that it's a regular pattern. And whenever there is any deviation from the regular pattern, your app notices like it, and then it notifies you. So it's a healthy habit to maintain a regular calendar, and especially those with irregular periods. It's a must, so that we can find out the irregularity and treat accordingly.